wonderful. Thank you all so much for joining. This is so exciting. My name is Kabir Ali. I'm the Chief Operating Officer here at my Ketamine home. And this is our first webinar. It's a first of an ongoing series of webinars that aim to provide our community here with the information I feel that we could all benefit from regarding ketamine-assisted psychotherapy and psychedelic integration. Starting off with some brief introductions. Leah Benson, joined with Leah over here today, who is a licensed mental health counselor who has been practicing for 19 years now. Almost a 20-year anniversary coming up over here, Leah. It's not only been a pleasure to getting to know Leah, but an honor to actually witness the feedback our clients have received through their ketamine-assisted sessions and integration sessions under her guidance. And I'm not surprised at all that she's rated to be one of the top 3 clinicians in Tampa. So thank you again for joining us, Leah.
Great to be here.
Awesome. In conversation with Leah, we also, as you can all see, have our medical director, Kazi Hassan, MD, joining us. And Dr. Hassan and our team at My Ketamine Home have had the pleasure, the honor of welcoming more than 600 clients to our program over the past year and facilitating more than 3,500 experiences under Dr. Hassan's supervision. And Dr. Hassan actually introduced me to ketamine back in 2018 for my depression and for my cocaine addiction. And thanks to the experiences I've had and the integration that I've participated in, my relationship with my mental health has never been the same. It's never been better. So thank you, Dr. Hassan, and thank you to clinicians like Leah. So I'll hand over my mic to you, Dr. Hassan.
Kabir, thank you so much for that introduction. I've been very much looking forward to this conversation. We've treated several hundred patients at My Ketamine Home, and the use of psychedelics in mental health is something that I'm very passionate about. I think there's some really amazing work that's being done right now by big organizations like MAPS and large academic institutions like Johns Hopkins. And we're just starting to learn what's the best practices of combining psychedelic therapy with psychotherapy and the various forms of therapy that are available for patients. What's really interesting about ketamine and psychedelics is that they're not traditional antidepressants. They're best used as tools and as catalysts for enacting long-term change. And one of the biggest things that we found in our patient population, and this is true across the country from experienced providers, integrative psychiatrists, is that a close relationship with a therapist is one of the most significant modifiers of a patient's treatment response. And so it's really a joy to talk to Leah today about how she got involved with ketamine therapy, and just to learn from her 20 years of practice of how she looks at trauma stored in the body and how she deals with somatic type therapies. So thank you, Leah.
All right, really good to be here. I'm excited about this talk myself.
Yes. So Leah, I mean, we were just talking before this, but can you walk us through your career and when you started seeing around you and when you started learning about somatic therapy? What is somatic therapy?
Well, it's a therapy that understands that what happens in the mind is reflected in and can be directly modified and when worked with in the body. The mind and body are not separate. Mm-hmm. So that's the sort of broad brushstroke main premise. So to answer your question, I worked since 2001. I sort of began with sort of traditional kind of a combination of working cognitive behaviorally with people, kind of like working on thoughts and changing thought patterns, looking at reframing, things like that, and a very strong psychoanalytic background, you know, just the old fashioned from Freud, kind of all the way up to the more modern psychoanalytic thinkers, relationally based. So when I started my full-time private practice in 2010, I started to realize, you know, there were people who, you know, they could understand things and we could talk, but they weren't feeling. I wasn't getting a sense that they were connecting to feeling in the office. And I started really like searching. And by about 2014, 2015, I was like, I have got to find a way to bring the answers in the body, because feelings are in the body. And so I really started searching and searching, and came across a training program in a somatically based psychotherapy called Bioenergetic Analysis, which is sort of the first child of the original body psychotherapist, whose name was Wilhelm Reich. Anyway, so this bioenergetic analysis training that I began in 2017 really sort of blew open the doors for me on being able to help people effectively and efficiently in a way that was, because psychoanalysis works if you are connected to your body, but it takes a very long time. Whereas bioenergetic analysis techniques, body focused therapy really moves you into the body. And of course, you have to be careful about that, because sometimes connection to the body is overwhelming for people, which I'm just going to add is part of why ketamine is so great. But let me back up. And but that connection to the body is really the foundation of really being able to change your mental health.
It's so interesting to hear you talk about how emotions stored in the body, trauma stored in the body. Can you explain what that means, and how do you see trauma as being stored in the body? What are you looking for?
Okay, well, this is going to be a very simplified explanation, but so in essence, when we respond to a traumatic situation, which is traumatic situation being an experience where you feel overwhelmed, helpless, or afraid. That's really kind of to understand what that means is, and so it's different for everybody. But our body responds by getting ready to fight or flee, which means that we're activated. Our muscles get tight, our breathing gets shallow, everything. We're ready for a fight. I almost kind of feel a little activated right now in this situation. Okay, being in a webinar, I'm activated. So my legs are kind of tight and my tummy's kind of tight, and I could breathe more deeply, but I'm breathing more shallowly because I'm activated. So, and you guys, I can watch all your bodies. You guys are all kind of doing that too.
Yeah.
So
yeah. Sorry, go ahead. What
happens is that we get stuck in that way. And so we're not breathing deeply, and we lose touch with some of the places of chronic muscular contraction in our bodies. And that protects us from, let's just say, the memory of the time when that activation occurred. So the experience of feeling helpless, overwhelmed, helpless, or afraid creates that muscular armor that, if it happens constantly enough, is stuck. And if we start to relax it, we're suddenly in danger of that being overwhelmed, helpless, or afraid. So the stuck is the chronic muscular contraction. And then when you're letting it go, you might become overwhelmed, because you're, whether you remember it or not, in your implicit memories in your mind, which is stuff you can't remember, you just suddenly feel anxious. You suddenly feel afraid. You suddenly get overwhelmed. And so that's kind of how trauma gets held in the body. I hope that made sense.
Yeah, that was very, very interesting. So it sounds like you're saying that, these events in our life before created this kind of physical reaction, and the implicit memories we form from that in future moments, even if nothing is really dangerous or happening,
yes,
we go right back into the kind of the physical structure that was protecting us.
Correct.
In that memory.
Correct.
And you've talked a lot about the dysregulated nervous system. And can you kind of explain how you tie that in to the way that you view trauma and how you use that as a tool for or kind of an opening for self-regulation?
Yeah, I'm not quite. Say the question again.
So with people with who are dealing with somatic therapies for trauma, they talk about trauma creating a dysregulated nervous system.
Yes.
And I was wondering how, if that's your view of trauma, if you're looking at this as that, this person, this is just nervous energy that, it's maladaptive, but this is their nervous system. They're
Yes.
maybe at a little bit more in fight or flight and, hyper, the classic findings of PTSD, the irritability, the anger, the flashbacks,
Yes.
with the way that you view PTSD, as this dysfunction of the nervous system, how do you
Yes.
work with that? What is your kind of treatment planning for that?
Okay.
Yeah.
Okay. So basically so I understand that. And you're sort of saying like, okay, we're looking at it from this perspective, but a lot of people don't understand that. And so the very first thing is to say, hey, here's what's going on. You live in a body. And everything that you experience is looked at through the lens of what's going on in your body. And if it is overactive, spinal sympathetically activated, then you're just going to be hyper aroused and everything is going to look like a danger, because that is what our body is designed to do in that nervous system state. You have a negative bias. So first off, you basically learn, like, your body can be in this activated state. It can be in a dialed down, dissociated, what's called dorsal vagal, sort of brainstem. I don't know if it's brainstem primacy, but parasympathetic primacy, we'll say,
Okay.
or you can be in a more optimal state, which we could call socially engaged, or ventral vagal, which means, you feel, in essence, your nervous system feels safe. Whether you objectively feel safe in your conscious mind or not, if your body doesn't feel safe because there are things in your environment that are causing your implicit mind, your unconscious mind, to feel unsafe, then your body will be on alert. And so teaching people that is the beginning, because getting aware of what's happening in your body and then understanding the stories you are applying to what's happening in your body is the pathway from my perspective.
No, it's really interesting to hear you talk about awareness and how that ties in to concepts like mindfulness and meditation, and just being aware of all the things that are coming up in consciousness. And is that a technique that you use with your patients, or is there kind of techniques?
It's the foundation of everything I do with with them. If you don't know what you're working with, you can't do anything with it. I mean, you have to see the steering wheel to put your hands on it and turn it in a direction. So, some people, first off, don't have any connection to the sense of themselves in their body. I mean, they literally kind of don't feel their feet on the ground. If they're standing, they don't really feel their legs. They can't soften their belly. All of that creates a lack of connection to what's going on, a lack of interoception, which is this, the awareness of the sense of the internal experience of your body. And that without that, you're not going to be able to change anything about yourself. Really. I mean, you might be able to kind of, when you're conscious, do some things. What you're doing is making more of you conscious so that you can apply tools to changing what's going on in your body. Let's just say you're too activated. If you can notice that, you can apply tools to change that overactivation. I mean, that's a very simple explanation.
Oh, I'm sure it's eye-opening for people when they first start, feeling things come up for them. What is the typical progression you see when you start working with someone who had no idea that all this was happening, and then you start working with these mindfulness techniques?
Well, often, especially if someone has no idea, we have to move very slowly, because really the experience of feeling yourself can be very overwhelming. And I don't really know how to say it other than that. It's that when you start to experience sensation in your body that you have blocked out of your consciousness because it's associated with a historical experience that was overwhelming or frightening, it becomes overwhelming and frightening in your current, like literally in the present moment. And so you have to, with people who have not had any connection to sensation in their body, you often have to, almost always, you have to move very slowly, really just allowing them to just slow down and soften their belly. And even that can create a lot of anxiety for a person, because when you breathe more, you feel more. So when you feel more, it's a sort of a circle. And so we move very slowly of just gently, like placing your hand on your belly and seeing as you inflate, as you inhale, if your belly will inflate, if you can let go, right? So chronic muscular contraction, you're letting go and seeing what that feels like and noticing, does it feel like too much? If it does, it's okay. You can do what you need to do to bring yourself back to a sense of safety, because we're not here to blast you into fright and not get you anywhere. We're here to sort of millimeter by millimeter swing you into something a little more intense, but not so intense you flop over the edge.
Wow. Okay. And with clients that you've worked with for a while, and you feel like they're stalled in their progress, how often does that happen? I mean, we were talking earlier about the typical length of time people are with you. There's I'm sure there's going to be a lot of people who start, but for one reason or another, they don't continue onward. Then you said that there's that, that middle group that's with you for, more than 6 months or, over a year. And then there's kind of the people who are on the path of, self-actualization, they're just like with you for the long term. So can you tell me, what is the kind of the trajectory of most people when they start with you?
They have a symptom especially for the people that I work with, either they have a symptom, which is generally lots of times anger, very typical depression, anxiety, or anger. Sometimes it's relationship problems, but they're unhappy. That one takes longer. But if you're dealing with depression, anxiety, or anger issues, it's a very hard question for me to answer because it's so individual. But I would say I have discovered that my typical average number of sessions is 13.
Oh, interesting.
Yes.
Okay.
That's for someone who's not doing a long-term thing. So that's what I have found.
Yeah. And what can people kind of expect in 13 weeks of like training in this way and getting to know their body? What's the, what do people walk away with?
First off, an awareness, tools to continue to build awareness, and tools to apply to change their state as they notice what is going on. So they have tools to use in critical moments where they're like sort of overwhelmed, and in a way, the same tools used as a practice, as sort of active meditations, we'll say, physical meditations, to really kind of build a better capacity to be with feeling in their bodies. And of course, I can't make people do that, but if they are coming and sort of applying what they're learning, this is what they go away with.
And during this process of, would you call it self-regulation? You're teaching them how to regulate themselves?
100%.
Yeah. And in 100%. This process of self-regulation, do the kind of the memories or the triggers of where it all started for them, does that start to come up?
Absolutely. It's so interesting. Let's just say one of the tools is leaning backwards over a stability ball with your arms over your head and just kind of allowing that gravity to stretch as you breathe in and out. And if you intensify that, if you've been talking about some issue you're trying to resolve, very often an old memory will come up that is connected to the current problem. You know, it's a story of, you know, some issue with a friend or with a teacher or with a parent that's suddenly like, wow, I hadn't thought about that in a million years. And it's, you know, so the old memories start to come up, and, you know, it's those associations. I mean, that's how our brain works. You know, these don't come into our minds for no reason. So yeah, the old stuff starts coming up.
Yeah.
So, and I'm going to,
yeah, please.
I'm going to say, okay, so one of the great things that you can do once that has happened and you're in the feeling moment, you can actually express the things you would have liked to say in that moment, or move your body in a way that you would have liked to move it in that moment. Now, sometimes it takes a little practice of giving yourself permission to do those things without feeling foolish. And that's the value of practicing bioenergetic exercise, which is expressive and grounding exercises. So you don't feel like a fool and you have permission to do those. And then when those processing moments occur, you can do that. And you're literally processing those old historical memories that you've carried around with you that are stuck in your muscles. And yeah, so anyway, I just wanted to kind of go down that rabbit hole a tiny bit.
It's interesting. I wanted to ask a follow-up on that one. You know, with bioenergetic work and just movement in general, how do practices like yoga and dance and other things kind of fit into the work that you do?
Well, so it's all about your intent. So yoga being, you know, I'm not sure on the spiritual side of it, but I know that yoga is a demonstration of flexibility, and dance is, you know, about whatever the dance movement is about. Bioenergetic exercise and bioenergetic movements are about grounding the energy in the body and practicing ways to express the energy in your body in ways that do not hurt yourself, anyone else, or anyone's property. And that is physically or emotionally. So that as you practice these very big expressive movements of, you know, kicking or hitting or screaming or whatever, if that's not overwhelming for you, that you don't do that in front of people who don't understand it. You don't do that in a way to communicate to someone that you're upset. This is a way for you to move energy through your body, much in the way that you would go to the restroom and close the door and do your private business. You are moving energy. And so circling back around to your question, how does it fit in with yoga? It's all movement, but the purpose of bioenergetic exercise, body focused, therapeutic movement, as I do it, is grounding, being able to tolerate energy in your body without collapsing or being overwhelmed by it, and being able to express it at appropriate times and places. That's the difference. Okay.
No, that's very helpful. I really wanted to bring Kabir into this conversation. You know, Kabir is a lot of things for us. You know, he is really focused on patient care above all else. And for us, that means being able to connect patients with counselors. And so one of the biggest projects that Kabir has taken on is kind of, introducing our ketamine assisted psychotherapy course, Getting Comfortable with Ketamine. It's just a free compilation of the evidence around ketamine therapy, a few best practices, but it's definitely just a primer. You know, I think we're just starting to learn how ketamine and therapy work best, and I think that looks different for different people. So, you know, with bringing Kabir into this conversation, but first I just wanted to ask you, Leah, like, what's the experience been with introducing ketamine into your work?
Such a wonderful tool to facilitate comfort in the body and a lack of stress overwhelm to, for instance, practicing expressive exercises, to feeling the sensation of different parts of the body that have been dissociated from or chronically contracted. A really, really wonderful tool of facilitation.
Wow. Okay. And what's that shift like for people, you know, and, you know, at what stage of their ketamine treatment, or at what stage of your therapy do you kind of introduce it? Where have you found it to be most useful?
Again, this is a hard one because it is so individual. You know, some people are in a state where it makes most sense to just get them right in on ketamine, and others where there is the tools, the exercises of bioenergetic therapy have sort of met their limitation, we'll say. You know, there is, and I don't know how to explain that but that it's something that just stays stuck. There's something that is staying stuck for someone, that the relaxation of the ketamine and then the discussion and the integration of what occurs after that allows for now the integration of the sensations that they've been avoiding into their consciousness.
Right.
So again, it's not there's no protocol. It depends on the individual.
I want to draw some analogies from the type of therapy that you know, from your style of therapy and a lot of the things that come up for patients there, and a lot of the ways that we prepare and coach people, you know, into their ketamine experiences. Because our view of ketamine is really, this is not a chronic long-term therapy. This is a short, intensive treatment that is a very powerful treatment. At best, it's a very powerful catalyst for other types of therapy. Otherwise, really, it's a missed opportunity. You know, it's there's so much positively going on during someone's, you know, ketamine treatment window, where there's the neurobiological benefits. You know, one thing we know with chronic stress and PTSD is that there's atrophy of the synapses with long-term stress exposure. So ketamine very directly increases growth factors like BDNF, and it's providing the, you know, chemical environment for synaptogenesis and repair. And you know, a lot of people, you know, the phenomenon itself is this mental reset. But one interesting thing that you're talking about is the anxiety someone might have going into their body, because it's you know, all those implicit memories and trauma is coming up. One interesting aspect of ketamine as a non-traditional psychedelic is, you know, there's a possibility of a lot of different types of experience, but universally people feel a sense of floating and the separation from their body. So, you know, not saying that is the mechanism, but it's just kind of an interesting metaphor for being able to have difficult experiences and reprocess memories that are difficult, but feeling safe, you know?
Yes.
So it's really interesting to hear you say that.
Yeah. And I would say that absolutely is, you know, just subjectively from this side of it, that is what I see happening for people.
Wow. Kabir, I wanted to bring you in, and you know, Kabir's had an amazing journey with ketamine therapy, and then he was able to integrate a lot with psychotherapy. So Kabir, do you want to kind of share what it's done for you?
Absolutely. You know, when it comes down to my experience with ketamine, my first experience, I remember the date very fondly because it was such a game changer for me. Was December the 23rd of 2018. And that's when I truly realized that I had a problem. That's when I realized that I needed to actually do something about my depression, about my addiction. And the ketamine experience itself actually allowed me to take a step back and, I think, view my consciousness from a bird's eye view with a lot more clarity and confidence than I've ever experienced before. Because yeah, it was going on for some time and I was struggling for about 8 years or so. So the series of experiences, along with the support from my clinician, really allowed me to slowly and gradually, it was no doubt, it was a process, but the whole entire component of integrating my experiences, that was a learning curve for me. And that's actually a question that I wanted to ask you, Leah, is what advice do you have for those individuals who are currently exploring ketamine therapy? And for you, Dr. Hassan, I wanted to know, you know, the value, you know, around integration, the importance of integration. I just wanted to get your insights and your perspective on that, if you don't mind sharing.
Who do you want to go first?
Oh, well, if you don't mind going ahead and going first, that would be great.
Okay. So my thought is, and I guess Dr. Hassan can, he can confirm this, I guess, I hope. And that is that, you know, my understanding is that you can have an experience and it's great. And there are some things physiologically that are going to happen, and those are going to happen no matter what you do. But if you want a lasting effect and you want those, you know, I think you said synaptic something or others to, you know, if you want the reconnection of the brain to be happening, you have to tune the growth of those, of the roots that are going to create those new connections. And if you don't have the new experiences, and in other words, the new thought, the new thinking processes applied, then those things are going to, those new little roots are going to prune. Because if you don't tune them within 48, 72 hours, they're gonna prune. They either tune or they prune. I do know this about the brain. Mm-hmm. So anyway, that's my thought on it. And you know, that I have to kind of rely on the science for that. That's, you know, that's anyway.
I love what you just said there. You know, it's that's such a very apt saying for neuroscience. And there's another saying that, you know, synapses that fire together wire together. So, you know, it's interesting to think, you know, that yes, you can have a ketamine experience, and then, you know, if you're lucky enough, or you have enough self-awareness, or maybe even previous, you know, therapeutic frameworks, maybe you can piece this thing together. But if you just have more of a supportive framework, and you have more people on your team, that's the way we look at it. We're very team-based, multidisciplinary treatments, you know? And I think you're just really improving your odds at making this this relief that you feel long lasting. Yeah. And just to point out, like, kind of the efficacy of ketamine assisted psychotherapy, there's a lot of data coming out on exactly that, or KAP. And I think a lot of people are, you know, investigating which types of therapy lead to which types of outcomes. One of the sad truths of ketamine therapy is that without any other intervention, I mean, you know, 60 to 90% of people will respond with treatment-resistant depression with a course of 6 IV ketamine treatments, and that's in a span of 3 weeks. So just looking at that compared to, you know, traditional antidepressants, they take many weeks to start working, if they do at all. You know, it can be, you know, maybe a third of people respond to, and this is in the STAR-D trial, and this is kind of one of the largest real-world trials of antidepressants. They saw that, you know, roughly a third of people respond to first-line therapy, and then, you know, the numbers go up after the second and third, and then finally fourth phase of the trial, but cap out around 67%. But one of the sad things about, you know, the people who end up responding further down the line is that their remission, if it was remission or response, is very short-lived, and they end up falling straight back into relapse. So traditional antidepressants, you know, there's some features of antidepressants that it almost, in a way, you know, for some people can make your brain dependent on that constant daily, you know, chemical balance. So, you know, the idea of stopping it, you know, it'll just kind of put you back into depression, because now your brain has formed around this chemical being there. And if you take it away, well, now you've created a vulnerability in your mind. And sadly, if you do continue the antidepressant because you know that may happen, there are people that start to, no matter if they continue to take a stable dose over time, they just start to feel depressed, tardive dysphoria. So it's just this sad phenomenon that, you know, starting an antidepressant, it can really lead to a bad path. in fact, when people were randomized to either starting an antidepressant or starting CBT, now you take the antidepressant away or you take the therapy away. If you had gone with therapy, people will have a relapse and they will, some people will fall back into depression. But if you got them to remission with an antidepressant and you take the antidepressant away, they're going to do worse than the on average than the CBT and than the therapy group. And it sort of makes sense because in therapy you're picking up skills, you're learning, and you can take with you what you learn. So with ketamine therapy, we look at that problem and we say, 60-70% of people are going to respond in a short time compared to traditional antidepressants. But the sad thing about ketamine therapy is that in 3 or 4 weeks, 50% of people will relapse. So, people have devised different strategies around that. They have maintenance dosing, which hopefully over time becomes fewer and far between. Introducing a maintenance therapy session has kind of been our way of kind of dealing with the relapse problem. The way we look at it, however, is that this is it's another 1 to 3 months for someone to be able to develop the life skills and to be able to integrate what they just experienced so that they can walk away with a symptom elimination or significant reduction and the coping mechanisms that they're going to have to keep it.
Right.
Thank you so much for sharing. That's wonderful. Thank you. I think that those insights, from both of you are very, very, very helpful. We have a couple of questions over here. I thought that we could go ahead and get to. Is that okay if we dive right into those? Is all right? Yeah.
Sure.
Mm-hmm.
Yeah.
Mm-hmm. Yeah.
So the first one right over here, we've got Caitlin Sabi, who's basically asking a question with regards to your thoughts, perhaps, Dr. Hassan, on Spravato, and why is it that IV ketamine is the recommended form of ketamine? At least that's what Caitlin feels around the messaging, perhaps that's online.
Mm-hmm. It makes sense that people are more familiar with IV ketamine therapy because when ketamine was first FDA approved, it was mostly used for anesthesia and procedural sedation. So the physicians who administer ketamine are anesthesiologists. Anesthesiologists typically give ketamine through IV because it's 100% bioavailable. It's easy to titrate. There's several advantages of ketamine in the hospital for that reason. And when people started finding these kind of like fortuitous effects on mental health, then it just got shifted that okay, so we give it IV in the hospital for this reason, let's do IV therapy in an outpatient setting where the dose is much lower. It's a fraction of the dose. It's very safe, except for people with high blood pressure, and obviously you have to talk to your doctor for individual risk. But in general, it's well tolerated, and the IV therapy kind of like took off. It was this really amazing breakthrough treatment for depression, and then ketamine clinics became or are becoming popularized. And all of the early, randomized controlled trials were done with IV therapy in very treatment-resistant patients. But over the last 10 years, many oral ketamine, sublingual, and intranasal studies on ketamine have been done. Some of the big things to keep in mind are different routes of administration. If you take, a certain amount of medication and you do it IV, of course, all of that medication is getting into the blood, and so all of it is, or a large fraction of it, is going into the brain and producing the effect. When you take the same amount of the medication through another route, depending on the properties of the medication, a fraction of it is going to be bioavailable. So when we started dealing with this problem, because we've switched over to a largely oral telemedicine approach for ketamine therapy. And the biggest reason why is because while it is so safe to do, the actual procedure of having someone come into a clinic and have to be monitored for, 2-3 hours. That is a huge driver in the cost of ketamine therapy and ultimately limits accessibility. Unfortunately, because ketamine is generic, it's not covered by insurance for this reason. Hopefully that can change over time. But for us, we've found in our patient population, dose adjusting for this bioavailability, we found really good results so far. So, people are able to tolerate it. There was a lot of, optimizing this. There's a large variability in patient response. Everyone is different in the way they metabolize and respond to ketamine. But I'm confident that you can have a very positive outcome with oral ketamine, and it's very safe.
We have another, thank you so much for answering that question. We have another question over here as well with regards to ketamine for maintenance. Ketamine IM, what about ketamine IM for maintenance? That's a question from Moses Barboza. Can you comment on that at all, Dr. Hassan?
IM, yeah. So intramuscular for maintenance.
That is correct.
Yeah, and whether it's IM or IV, those. I would say that there's a lot of evidence behind intramuscular as well. So both are good routes of administration. They have different peaks and experiences. The IV is more of a steady state experience, whereas intramuscular can be very different in the way that people experience the peak. But in terms of the clinical efficacy, I think both are good solutions. But again, maintenance is it's one of those things where if you have the view that this is a medication that you're gonna have to be lifelong, it's more of the philosophy of that I'm kind of taking issue with, where I never tell people that past the initial treatment and the consolidation phase, it's not that we're planning on future treatments. We're more constructing a integrative psychiatric approach of looking at all of the lifestyle issues, the gut brain issues, the diet, so that people don't come back, and need ketamine. Ketamine is just this rapid stabilizing tool to reduce symptom burden and give people this window of opportunity. And then, they do the real work.
Thank you so much for that. No, I appreciate that. I'm sure our attendees also appreciate that response over there. When it comes to the side effects of ketamine, can you go ahead and speak a little bit to that as well, please? I know some of the comments over here and some of the questions are somewhat curious to know about the side effects.
Sure. So there's short-term, long-term side effects. The short-term side effects are really for some the psychedelic state. It's you can have kind of the auditory visual effects of ketamine, especially if you wear an eye mask and you're just having an introspective experience. Some people can have nausea, headache, increased heart rate or blood pressure. The big one there is the blood pressure. And, especially with people with high blood pressure on a few antihypertensives, we really pay close attention to that, because that would be maybe one of the more dangerous situations when someone's blood pressure gets very high. And then, people are going to have impaired motor function. So a lot of this is short-lived and is just more about planning ahead of time. We talk a lot about set and setting and planning and having a sitter and just making sure that, people are aware of all of the different things that can happen and not to be overly alarmed. This is self-limited. Your body's going to metabolize it. So it's that's kind of the short-term experience side effects. With the long-term effects, now in a clinical setting, it's very rare to have long-term side effects. Although this is still a young field with oral ketamine for treatment-resistant depression and mental health issues. So it's yet to be seen, but in general, some of the case reports out there can say there's inflammation of the bladder. There's issues with the gallbladder and emptying, but these are not things we monitor very closely for these kind of things, and we haven't really seen it in our clinical practice.
Thank you so much. There's a question for you actually over here, Leah, if I can go ahead and share from Natalia S. She says, as I understand correctly, you are saying that clinical depression, chronic PTSD, anxiety disorder, etc., could be cured solely by psychotherapy. Is that correct?
Am I saying that? I mean, I'm absolutely. Is it possible? Yes, that is possible. Yes, that is what I'm saying. Because psychotherapy that focuses on the body is addressing those issues right where they start. Am I saying that everyone could be helped in that way? No, because variation is the norm.
Okay. All right. Then I appreciate that.
Yeah.
And I think we have time for just one or two more questions over here. Thank you so much. I hope that's okay, everyone. But basically, here's a question as well, and feel free to go ahead and share over here, Dr. Hassan. But how important is an intention going into the experience? Is it okay if an intention is hard to hold throughout the whole entire experience? Can you comment on that? And of course, Leah, you're more than welcome to chime in as well.
I think this is a great question for Leah, actually.
Thanks.
Well, I can tell you from the experiences of the people I've been with, it can be very hard to hold on to an intention, but that's okay because an intention is conscious and what's going on is unconscious. So you are allowing yourself to sort of let go of the consciousness and let your unconscious do the work. And then the integration, you can kind of return to that and use what you experienced and your associations afterwards. So that's my perspective on it.
Well, wonderful. And last question, right over here for today, folks. When it comes down to Jake over here has a question. I just lost that one. Sorry about that. And sorry about this, guys. Is there an exercise that we can actually do after the actual treatment itself to increase the effectiveness of the experience? That's a very interesting question. Would you like to go ahead and answer that one, Dr. Hassan?
The effectiveness?
I know if there's an exercise that one can do post an experience after a ketamine experience that can perhaps increase the effectiveness of the experience.
I wonder what someone would consider an exercise, but it's really just this whole process of integration. It's making meaning from the experience. Some people look at these ketamine experiences as a way as a method of self-discovery. So you're looking for pearls for yourself. You're kind of like diving into your subconscious and you're trying to make meaning. It might be very difficult to do, especially on your own. And that's really where therapy comes in. It's you're kind of led through a more structured way of doing it with someone else's guidance.
Wonderful.
I would totally agree with that. I mean, it's like, what's an exercise you can do? Well, you can journal, which is something you can do on your own, but you can have a counseling session and integrate what you have experienced and have the perspective and the presence of another human being who feels safe, which is so much about what alleviating mental health issues is about not being isolated and feeling safe in your body and in relationship. And that is an exercise you can do after ketamine that ketamine facilitates in enormously.
Beautiful. Well, thank you so much. I just want to basically thank you both for taking the time to go ahead and attend today. I think, our time is up for today, but for all of those that went ahead and attended this webinar, thank you so much. We really do appreciate your support, and we're going to be having a reoccurring webinar taking place. It's going to be on a different day every week, depending on our guests' schedules. But we are going to be having weekly webinars, and we'll be sending you some information with regards to how to get in touch with Leah and how to go ahead and participate in our program. And just basically, if you want to just reach out and ask our team any questions, we're more than happy to help you guys. So
Kabir, can we include or Leah, what's the best way for people to reach you or find out more information about your therapy? Is that somewhere here?
LeahBensonConsulting.com.
Okay.
And I went ahead and I shared the link over here in the chat, guys. So you have that over there, and I'm going to share it again before we close today. So, and everybody will be receiving the email as well, Dr. Hassan.
All right.
That's great.
Awesome. All right, Leah, it was such a pleasure. Thank you so much for taking the time.
Likewise. Really good talk.
Enjoy your weekend, everyone.
See you guys.
Thank you, attendees. Thank you. Thank you, everyone.
Thanks, everyone, for coming. Bye.
Bye-bye.